oil and dead skin cells, right? So how will it present? So you're going to have your pimples, you're going to have blackheads or whiteheads, right? And the distribution is mostly going to be on the face, forehead, chest, upper back, and the shoulders, right? So acne, I'm sure most of us are familiar with it. It's a very, very common condition. And even as we look at the prevalence globally, we can see that it's estimated to affect about 9.4% of the global population. That is dangerously close to 10%, right? So we can see that furthermore, more than 80% of the world's population will be affected by this skin condition at some point during their life. So acne has a very significant impact on personal body image, and it can greatly affect the quality of life. So we can see that the prevalence is different among different age groups. So it will mostly peak during the ages of 12 to about 24. And we can see that about 85% of the people in this age range will be somehow affected. I'm sure most of us on this call can relate to these statistics, that it really peaks during those early stages of life. So as we continue our conversation, it's really helpful for us to just ask ourselves, so we know we'll have your pimples, blackheads, whiteheads. So what are these factors that contribute towards the formation of these symptoms? So first of all, there's sebum production, right? There is follicular hyperkeratinization. You will have bacterial colonization, which is a really interesting one that we will discuss more. You'll have, of course, inflammation. There's a very significant role for hormonal influences. And then, of course, there can be some genetic predisposition to the same. So on to our first point, sebum production. So sebum, it's an oily substance that is produced by the sebaceous glands in your skin. So normally it's present to help protect the skin and to lubricate the skin. However, you can have certain cases whereby there's the excessive production of this natural product. So when this happens, it leads to oily skin, which can now contribute to the development of acne. So now, as we can see, someone who has naturally oily skin, of course, everyone has a different type of skin profile. You can have oily skin, dry skin, combination skin. So people who naturally have oily skin will tend to produce a lot of this sebum, which can now contribute to the development of acne. So as we can see in this lovely diagram here, so when sebum production is elevated, excess oil can mix with the dead skin cells and block the hair follicles, forming now our blackheads and whiteheads, or you can call them comedones, right? And this will now provide an environment where bacteria can overgrow. As you know, the skin is the largest organ in the body, and the skin is what kind of protects us from the external environment. So it would make sense that your skin has, the highest exposure to bacteria. I mean, we have bacteria all around us, when you go wherever you are, right? You are exposed to bacteria. So the second factor that we can look at in the pathophysiology is the follicular hyperkeratinization. So hyperkeratinization refers to the abnormal buildup of normal skin cells, which are the keratinocytes, within the hair follicles. So if someone is acne prone, right, what would happen is that these cells lining the follicles may become really sticky and they clump together. So when this happens, it causes blockages that will prevent the normal shedding of the dead skin cells. So you shed a lot of dead skin, throughout the day, from when you wake up in the morning to when you go to sleep at night, your skin is constantly shedding, regenerating itself. So this process, known as follicular hyperkeratinization, contributes to the formation of, again, comedones, which are our blackheads and our whiteheads, and it will lead to the development of your acne lesions. So this is also something to keep in mind. Now, something else that we have already, hinted on is the bacteria. So as I said, your skin is your barrier, it's your shield to the world, And so it makes sense that your skin will be exposed to a very large concentration of bacteria. So of note, we have P. acnes. That is a type of bacteria that naturally resides on the skin. But when you have someone who is prone to acne, this particular bacteria can proliferate within these blocked hair follicles. And it will feed on the excess sebum and contribute to inflammation. So this bacterial overgrowth triggers the body's natural immune response, leading to the formation of inflammatory acne lesions, such as your papules, your pustules, your nodules, and your cysts. And we'll be able to have a look at what some of these lesions will look like. Again, we cannot talk about acne without talking about inflammation. Inflammation plays a really central role when you're looking at the pathogenesis of acne. So when the hair follicles become blocked, right? As we've seen, that can happen, right? And then now the bacteria also multiply within them, right? Now your body's immune system, it will start to respond. How will it respond? It will release your inflammatory mediators. And in essence, this just makes things worse, right? So this inflammatory response will lead to redness, swelling, tenderness. We know the hallmarks of inflammation, and this will be around the follicles that are affected, contributing to the development of the inflammatory acne lesions. If you notice, especially in maybe Caucasians or Africans who are of a lighter complexion, you might see, especially during a flare-up, right? There is some redness, at the specific areas that are most affected, right? Now, another star of the show in acne is hormonal influences, right? So hormonal fluctuations, particularly during puberty, menstruation, pregnancy, and menopause, right? Which some people say is like, like reverse puberty, like when you're young and the hormones are just trying to find their way. That's now the puberty during adolescence. And then now menopause, it's like the system is winding down. So you can have acne again, unfortunately, which is primarily hormonal acne, right? And then we also see that, especially in women, factors like menstruation, pregnancy. I mean, the women here who might be acne prone can somehow tell when their periods are about to come, because some people experience acne as one of the first signs that, okay, something is changing in the hormones. So this is really, really relevant. And this can influence, again, the sebum production, which was our first point, right? And contribute towards acne development. Now, not left behind, androgens, such as testosterone, will also stimulate these same sebaceous glands to produce even more sebum. So elevated levels of androgens can lead to increased sebum productions, which makes certain individuals more susceptible to acne breakouts. And our last point, which I must say is really the underlying, insidious factor that can really affect a lot of the environmental factors, is genetic predisposition, right? There are some individuals who just have a family history, right? And that means that they are more prone. So genetic variations may influence your sebum production